Thanks. So thanks for the invitation. I'm perhaps present myself for those who don't know me yet. I'm working at the core and leading a research project called Maelstrom Research, where we're developing tools and various resources to facilitate data harmonization across large studies and small one as well. So developing harmonization platforms, study catalog, as well as some software. But today we will not talk about Maelstrom, but more about the issues that we need to address while we are collecting, integrating, managing, sharing, and as well using research data. So often clinical research involves collecting a broad range of data from various resources, and that can become rapidly particularly challenging. That raises millions of questions. Where do I put my data? Which software I should use to collect? How to access available questionnaire that could be used as standards, what is the size of the server I need to use. All those questions arise through the life course of the research project. And it's really important to take time to address these questions at each step. And we will pass today across all of the steps that are mentioned here. But the first one is to initiate. So you need to conceive your idea and apply for funding, but ask for proper support to achieve all the data management and coordination aspect as well. Then comes the implementation where you launch the activities, but you also need to define the sources of data you will need. You need to develop the tools to collect the data. You need to implement the data management and warehousing infrastructure and pilot all that to make sure that at the end you will have an infrastructure that is ready for the collection of the data in the sample. Then comes the production. So you collect the new data or you extract the information from existing resources. You integrate all that together, ensure quality, make sure that the data is preserved properly and available for analysis, so ready for analysis. And then at the end, it's the time to explore and analyze the data. So let's talk about the initiation phase. So obviously, like you learn in epidemiology courses, that you need to have a clear research question and protocol. But as well, in an ideal world, you also have a proper idea of all the operational, technical, methodological, and ethical legal aspect of the project. You need, when you build the project, to have an idea of the specific data you will be required, the sources of the data, the data collection plan, the software used to manage the data, what will be the warehousing infrastructure that will need as well to be implemented. So what you need to know is to have answers to what information you need and which participant you need to support your analysis, but as well, what is the data infrastructure you need and if it's realistic. All that to make sure that you put enough funds in the grant application to support after that all the issues related, issues related to the data management, which is often not the case. Then comes the implementation phase, and that's when it's time to do things extremely well. Often I have people coming to me with the funds and we work together on the grant, but when the funds arrive, they want to have all those good ideas that need to be added to the collection. But the budget is limited. So you need to always make sure that the balance with what you want to do and what you can do is the right one. And it's as well really important to take the time required to properly do things properly. You know, you receive the funds, sometimes it can take months to sign all the contract, do the ask for the to submit to the ethical committee to prepare everything. And when 6 months pass, you look at the agenda you put on the grant, and you need to start the collection of data. But you cannot just create all the tools and all the environment required to collect data in a couple of weeks. So it's really important to take proper time to implement and build properly all the tools and the resources you need. Another thing I think as well that is important to mention is when you build your infrastructure, you always need to keep in mind your research question and the type of analysis that are foreseen, because you need to collect all the data. I worked a couple of years ago with a project on asthma, and they had a lot of questions on passive smoke exposure, the attendance of the kid to the kindergarten and all those, but never ask if the children were allergic to cats. So it's really important to take time to think about all the potential issues and that need to be addressed, and the data that need to be collected to answer the question. And finally, I know it's sometimes perceived as the boring part, but it's important that data management, integration, cleaning, all those things are extremely important to enable the optimization of the use of the data at the end of the day. So it's important to invest the time that is required. So first thing, at the implementation phase, the first question that is to be raised is, what are the different data sources? So are we talking about just questionnaire or medical exam, or you will need as well access to the hospital medical file and some lab measures that are hosted elsewhere? Will you need to link with different administrative registries, for example? So it's really important to define the specific sources that you will need and explore if they are accessible or not, and how it will be possible to access these data. Perhaps you will need to ask for access. Perhaps the data format will not be compatible to what you implemented. So it's extremely important as well to explore what is the data content and format, and if the access to individual participant data is possible or not. Finally, if data is good enough, it's one thing to say that you want to access medical files, but if half of the information is missing for your participant, it doesn't put all the work. So having in mind the quality of the data is as well essential. The following step is to define the exact information you want to collect. In the grant, often we put, yeah, we want to collect socioeconomic characteristics, but when you start the collection, what is socioeconomic status? Is it the income? Is it the education? Is it, you can ask many different questions. And if it's the income, is it the income of the participant, the income of the family before tax, after tax? If you want the income, do you also need to have information about the number of members in the family? So it's important to take time to think about all those things. Same thing for let's say, the number of cigarettes smoked during the first trimester of pregnancy. Is it okay if the information is provided by the partner, or it need to be provided by the mother? Is it okay if it's provided at the end of pregnancy, because you can have a recall bias? So all those issues, again, need to be kept in mind. Same thing if it's the data are extracted from an existing resource. And you also need to think about the variables that are required to interpret the targeted variable. The example for the family income is a good one, where you collect family income, but you also perhaps need to know the number of family members. And often what I see is that people will just say, okay, let's collect information and we will see later. The problem there is that it's a lot of energy to integrate, organize the data set. And at the end of the day, if you just use 10% of the data that is in the database, it's not necessarily a good cost-effective way to achieve the work. Now, the other thing that you need to think of is to define the rules for ensuring the quality of the information. What are the units? Is it the kilogram or it's the pounds? Is it what do you need to have categories, for example, for don't know and refuse to answer? Will you need those categories for all of the question addressed? What is the acceptable variable range? Like a person with 2.5 meter height, is it acceptable for you or not? Because all those can be implemented, those rules can be implemented in the software that will be used to collect the data. So it's important to think about it before starting the recruitment. It's easier to collect with the rules embedded in the software than to clean afterward. And think as well about the format of the variable. If we have the example here of the type of cancer, you can have a selection of one, so type of cancer. So that means that you will have one variable with the categories 1, 2, 3, 4, 5, etc. And another variable for the specify if you selected others. So that means 2 variables. Or you can have 11 variables with breast, colon, lung, liver, a check for each. But if you do a check for each, is it better to have a yes, no for each? So the format of the question could be breast, yes, no, colon, yes, no. So there is no like good or bad way to do things, but you need to think about it, because at the end of the day, perhaps the format, like if you just do a check for breast, colon, lung, etc., without knowing if it's a no or a yes, if it's not collected or not answered by the participant, you will not know if it's a no or if it's a missing value. So all those little things can influence the quality of the data that will be generated after. Let's take another a couple of additional example, and those are real example that I've seen. So I didn't invent bad ways to ask questions. Here you have an example with pain in breast. Yes, no, right, left, new. That's not a variable. Here we are talking about pre-information. Pain in breast, yes or no. Another information that it's right, left, or both. And another information that is it new or something that was there for a long period of time. So collecting information that we will not allow to properly use the data afterward. Another example here is the familial income in the questionnaire, where you have a lot of categories with small range and 40,000 and more. So depending on who is your population, perhaps you will have half of your population that will have the category number 4. So it probably would have been better to add additional categories to be able to have all the range of income. I mentioned earlier the addition of prefer not to answer and don't know. Sometimes it's good to add it, sometimes not, it depends. It's something you need to think of as well. The range, the overlap between the categories, like here you have 2 to 5 hours, 5 to 10 hours. So I can, if I click there, think of 5 hours, and you can, if you click there, think of 5 hours. So it's really important to make sure that the categories do not overlap. Little things like that, again, you probably, I don't see you, but you probably look at that and say, yeah, it's obvious, but no, those are, that one, I've seen that questionnaire like 1 day ago. Same thing for the CRFs. Education details. Okay, but you will not be able to analyze that information afterward. It will be depending on the person that will enter data, different format and text. And same thing for the duration. Here you have duration alcohol and duration stroke. Doesn't mean the same thing. Probably stroke, it's the onset, and alcohol is it duration since the person stopped? Is it the total duration of time while the person took alcohol? So it's quite vague. Another example, and that one is just the look of the question. Here we have, in fact, 2 questions. The first one is the family structure, so biparental, monoparental, etc. And the second one is if monoparental, mother, or live with the mother or father only, if it's reconstituted, and the categories. The problem that happened with that questionnaire is that the mothers were completing the questionnaire really rapidly. So we have 4 persons that click on live with mother only, but without clicking on reconstituted or not. So we could have just clicked there and say, yes, it's reconstituted, but we decided to call the mother and check if it was reconstituted or monoparental. And on the 4, 2, in fact, were monoparental and 2 were reconstituted families. So you cannot like interpret anything. So we had to, and it's impossible to always call back the participant to double check. So it's really important to avoid having, like in that case, to put missing values to all of the mothers, and if we didn't at the occasion to double check all of the mothers that click on mother only without clicking on another one. You also have finally the quality of the data. That is another example where we had a discussion for hours and hours and hours with a group of investigators that wanted to decide how to collect information about alcohol intake. So some of the investigators wanted to just ask the number of drinks in a typical week. Others decided that it was better to separate during the weekend, the days and the weekdays, and the weekend days. But decided that the weekdays were Sunday to Thursday and the weekdays were Friday to Saturday. And finally, others wanted to have in the last week the number of drinks on the Monday, the Tuesday, the Wednesday, etc. So depending on the choice, you will have an impact on the quality, yes, sure, but as well on the precision. And the choice that was made at the end was the middle one, but I'm not sure it's better than the first one. but that as well need to be discussed with the PI before starting. A final example is a questionnaire on physical activity that was selected. So it was the long form of the IPAC. So the IPAC, it's the International Physical Activity Questionnaire that was selected and completed by the participant. But the IPAC long form, it's 27 questions, and it was too long. So the PIs decided that it would be better to use the short form of the questionnaire. And in the room, there was someone speaking loud and saying that he read the paper saying that the two were equivalent and it was fine to take the short one. But that was not true. And at the end of the day, 1/3 of the participant, the first third of the participant used the long form, and the 2/3 the short form, without having any of the participant with passing the two, completing the two questionnaire. And here you see the distribution of the information collected with the, here, that's one is the short form, and the other one is the long form. So it's possible for a user to just take the minute and analyze the data without, if they don't know that information, using the data properly. So first thing, do not change the question when you start the collection. But second thing, as well, it's needed to document the information properly, not just only the variable, but the information around the variable to facilitate the analysis. Next step is the collection, integration, and hosting of the data. So the implementation of the resources required to collect the data. To integrate, and integrate means two things. You can integrate when you link for one given participant the data from different sources. So the questionnaire, the physical measures, the lab measures, etc. So it's the linkage. And it can be as well the harmonization. So the data collected for different participants, but the similar data across different data collection centers, for example. And then the warehousing infrastructure. So let's start with the collection. So the first thing, all the studies have the same structure. Sometimes it's just an Excel file and everything is solved with an Excel file, but you need always to have a way to collect your information, a different or same software to store, manage, host, link, harmonize, organize your data set. Another or the same software to support analysis. And sometimes when it's large project, it's important to be able to disseminate properly on a website the information about the data collected. And then you have the requirement to support the management of the access to the data, where I can perhaps have access to all the individual participant data, while someone else will only be able to have access to aggregated data. So any infrastructure need to be secure, but adapted to the needs of the project as well. Often we have like big infrastructure or really costly infrastructure that are not necessarily what is required to support a small project. And it needs to be flexible as well. If it costs $10,000 each time you're changing a comma in your data set, it's not a good idea. So it needs to be flexible and easily extendable or modifiable, and obviously cost effective. So to collect the questionnaire, to collect the data, is REDCap the right solution or not? Always same question, coming back and back and back. You have other solutions as well, but what is important there is to make sure that the software that you will use will be user-friendly to complete by the participant or the research assistant collecting the data. User-friendly, ideally, to implement the questionnaire in the software to build the data collection infrastructure. Ideally as well, enable the support of multiple languages. It's not obvious with REDCap, but others are not necessarily better. Facilitate to have like different layout for the skip pattern, but always have a good way or a user-friendly way to answer the information. Manage easily the confidential information, easy to extract or export data to another format to transform the data in a format that is supporting, that is the right one to support analysis. But as well, and what is the most important is try to think about the cost that can be rapidly increase. So ideally work with an open source software when it's possible. The other thing that the data collection software, not always, but often can help you to do is to manage the different steps of the collection of the data. So here it's an example for the data collection center of CLSA, where the software follow the participant at each step of the collection and integrate automatically the information collected at each step. So that is something that can be particularly useful for some project. So that's for the collection, but you also have the often the need to integrate data from different sources. So you collected information with your questionnaire, but then you need to link the data from the health registries and or the lab measures and different from different data sources. You have software specialized to do that. Opal is one, but you have others as well. And when I mean Opal here, I'm not talking about the Opal of John Kildea. It's another Opal, different software, but complementary ones. So it's not like in REDCap that you will be able to build your data infrastructure that will enable all those features that are necessary when you integrate. Here you have an example of the study timeline and the different data collection and the integration of the data at different time points from different subpopulation can be particularly challenging. So it's not just to put all the data set in a big pool of data. You need to be able to properly attach to what data collection event the data collected. Here you have, for example, the information, the time point for the data collected for the mothers, for the fathers, and for the children. By the 3D study. So at each time point, there were some different data collection and integration. So at the first baseline visit, integration from lab measures, the pedometer, the questionnaire, and the 24-hour recall, for example, that need to be integrated for that time point. But at other time point, you will have just questionnaire data. So it's really important to try to figure out how will be structured all the link across all of the data sources that are used. So that's for the linkage. But often what is happening is that there are several data collection centers collecting similar data, but that want to pull together or co-analyze the data collected across different centers. In some instances, like for CLSA, it's one tool collecting exactly the same thing across all of the collection center, and that simplifies your life. So that is the little ducks. That's the perfect situation with CLSA, where it's one data collection, but across different centers. But what is often happening is that you're working with a colleague in St. Justin or in Toronto, collecting same data, but not exactly same data. So that doesn't mean that you can automatically just pull all together those data that were collected a little bit differently. So it's important to, in an ideal world, prospectively, so before starting the collection, to speak with all of your colleagues and agree on the core set of information to be collected exactly the same way across all of the data collection centers, if it's possible. If it's not, that's what you will have to deal with. So the messiness of having to pull together data that is collected, but without being coordinated across the centers. But even when we coordinate across the centers, and it can be problematic. So here you have the example of the Campath project, where data were collected by 5 studies across Canada, one in Atlantic, one in Quebec, Cartagena, one in Ontario, one in Alberta, and one in BC. We sat down together and agreed before starting the data collection on a core set of data that would be exactly the same across all of the cohort. We were there, decided the questionnaire, the question to be asked, the exact wording and categories of the question for everybody. But people went back home and changed the question. So at the end of the day, what happened is that what you see there is the baseline questionnaire. So after having agreed on the questionnaire, Atlantic Path, so the Atlantic provinces, finished with 2 versions of the questionnaire because they decided to change the questionnaire in the middle of the study. To here, cut the questionnaire by half because there were too many questions in the questionnaire. It was too long for the budget they had. In Alberta, it was the contrary. They started with less question because they had to start rapidly and add the question on the medication and health and different comorbidities on the second version of the questionnaire. And it's the same thing for all of the studies. So instead of having one same exact questionnaire or data set, or 5 but identical, we ended with 12 different data sets with different level of completion for the variable, the questionnaire and the variable that were selected. But the scenario is even worse than that. It's not true that 46% of the variable can be shared across all, because it's not always the same variable that were different. So what you end with is a kind of for each of the variables, sometimes it's compatible, sometimes not, depending on the different data set. So depending on the question you ask, you can perhaps just pull together 50 participants instead of the full collection. In that case, it's 300,000 participants in total, so they have a large sample size, but the situation would be exactly the same across 2, 3, 4 clinics. So what happened is that at the follow-up, we sat down again and said, okay, this time we will do it right. We will not change anything at all, you promise. So they went back and changed the questionnaire. So at the end, it's better. So instead of having 12 different data sets, we have just 5. by 5, 6. But even here, you have some differences between the data set. Obviously, if it would have been worse if it was retrospective and with no agreement before starting. So, but it can still be problematic. For example, if we take back that example with the follow-up, in fact, the differences that you see is that for 3 of the cohort, they didn't collect information about the work status. Others, it's more the medication, so they had less potential to collect information about medication, but you have one that selected not to collect the birth date and the date of questionnaire completion. So it's impossible to calculate the age. I hope you're traumatized. I don't see you, but that's the...
We're all traumatized, Isabel.
That's the objective. So finally, the hosting of the data. Sometimes it can be a simple Excel file, but generally what you will have is a more complex infrastructure where it can be pulled on the same server or distributed across different servers if you have different data collection center. So there are different solutions to deal with the infrastructure, and I don't think we have time today to go in detail there, but just keep in mind that it's not the most problematic problem. If you have good data, you can build an infrastructure generally that will enable the hosting and management of the data. Production now. That's just the implementation phase. Production, you're supposed to have solved all of the problem and sleep, but no. You still need to keep awake and double check regularly the data that you're collecting. And here I'll give you an example. I like that example. I worked, the first job I had long time ago. We had a questionnaire and interviewers that going to visit elderly people in Saguenay-Lac-Saint-Jean. And one of the interviewer was a nun and volunteered to collect information for all the nuns. No problem. So she took all the participants that were in the community. And after 6 months, 8 months, we started to look at the data collected and saw that all of the women had really low alcohol consumption. And we look and explore, and finally to find that that nurse put 0 for alcohol consumption to all of the nuns she was interviewing because she decided to do that. So it's extremely important to be able to rapidly identify those problems and fire the bad interviewers, but that's another question. And for the data exploration and cleaning, you have like simple things like just double check that you do not have 2 times the same participant. I've seen in some studies 3 participants entering information because they wanted to have the voucher, I don't know, to go to Tim Horton that was given when you were entering information online for on the questionnaire. So it's extremely important to explore those things, to verify as well the format, do double check of the outliers and things like that each 6 months, depending on the data collection rate, but regularly redo the validation of the data. To avoid having like someone smoking 225 cigarettes or having here the example is the sitting height example. I think it's an extremely good example. So you remember the Campath study that we discussed earlier. They also collected information on sitting height for a subset of the participant. And in different data set, here you see the distribution of the height for all of the data set. And for 3 of the data set, the height was like really low. And the others, the 5 others, was higher. So we double check, and the real height should be around those. And explored and found that these 5 forgot to subtract a part of the device to arrive to the right measures. But that was sent to someone. The data was already analyzed by a researcher that was writing his paper saying that there was really big differences in the height of the people in Canada. So extremely important, again, to have a proper look at the data. Finally, the production is the preparation and the preservation of the data set. So you need to often be able to go back to reaccess the data set that you use to generate your papers. So you need some time to have different version of the data set because you know, you have, let's say, the version at day 1, but you have participant that retrieval that you will need to manage. You can find errors and modify the data set. So you need to have often different version that will evolve through time and that you will document. So if you use the version of October 2020, you need to mention it in your paper to be able after that to come back to that version of the data. And to document as well properly the each of the variable and the information required, like I mentioned earlier, to understand the use of use the data. Perhaps you today know exactly what is in the data set, but the postdoc that will come in 2 years will pass like weeks and weeks just to understand the data set. And when that person will go, the next one will have to relearn everything each of the time. It's like reinventing the wheel each time. But if you have a structure where it's extremely well documented, someone will rapidly be able to jump in and use the data. And that includes not only the variable per se, but how the information is collected. What is the sampling frame, how the participant were contacted, and all that information around the data collection. Finally, you have the step of the data access request that often need to be monitored as well and facilitated. It's more for data platform than for a unique project, but that can as well, you have different tools that can be particularly helpful to manage the data access request. Finally, the analysis. In fact, if you look here, you see that the analysis, the total number of hours dedicated to analysis is really low compared to the number of hours dedicated to the data management. But I think it's the reality. Like I mentioned earlier, good data can lead to more scientific papers. Because effectively, if you have low quality data, you will have more difficulty to understand and analyze the data as well as interpret the result that you will generate, and less paper. And low quality of data infrastructure will increase the cost and the effort and can lead to various security issues and will probably also have impact on the data and the quality of the data and metadata. But in life, it's like what you must do is one thing, but what you want to do, generally people want to do good data management, but what you can do with the budget that you put in the grant at the start is another issue. So Caberi had a good idea, is to build a data capture and management platform that will be launched really soon. That will be a little bit like the stat analysis, the stat unit. And the aim of the data capture and management platform will be to propose to the core investigator cost recovery resources to support the implementation and operation of studies. It's not like the doing all the work, but more some expertise and tools to facilitate the work and conceptualize the data collection and integration infrastructure, the data collection infrastructure as well, and provide for REDCap particularly, but potentially other software as well, some support. Thanks.
That was amazing as usual. And I apologize for coming late. I had another Zoom that lasted longer, but I'm sure there's questions. Does anyone want to pipe up? I'm not as expert. I have the chat open though, so I can call out. I saw upwards of 40 attendees, and I think, you know, every time I listen to Isabel, there's more of the concepts that sink in. But I think, as Isabel says, you know, we often pinch hit and do what we can, but you know, with having the intellectual capital of Isabel in house and all the wonderful researchers and research that we do, to be able to bring this together, to really understand how to properly collect and treat our data. If we're respectful to our data, it will really give us great gifts, I think. And you know, I think we're all gonna find this an incredibly important resource. But does anyone have any questions for Isabel?
I have a question, it's Nicole, about harmonization of consents, or how we deal with different consents across different sites. It's maybe a little bit outside the scope of the talk, but in the interest of talking about harmonization, because I know now our consenting process has sort of changed in the context of the pandemic, because now we can get verbal consent. I wanted you to just kind of comment on tools that are available for consenting participants, and harmonizing, how we should go about harmonizing consents at different sites, because they're often different for one project. I feel like I don't really have a good grasp of how REDCap can enable that, because there is a consenting module on REDCap. I don't know if you have a comment on that.
Yeah. In fact, there is a group led by Barta Maria Knoppers in McGill that develop generic consent that are, I think, particularly useful. And you can find those generic consent on the Maelstrom website under the REACH platform, but I can as well just contact me and I can give you access to those generic consent. It's not perfect, and obviously, like you mentioned, there is like some specificities across different organizations collecting data. What I generally like to do is to work with a consent that is as close as possible across all of the centers. But if you have specificities, to have checkbox, like I consent to for my data to be linked, I consent. So to have different checkbox that facilitate after that to monitor the different participant, what the different participants agreed on. But for the rest, having like one ethical committee or one committee making sure that the consent is the same across all of the data collection centers, something that should come one day, but that is not yet the reality. But a lot of work is done in that way to facilitate, but you will still need to have one consent per organization that is collecting the data, and they will probably not be the same.
I have a question, Isabel. First of all, thank you for a tremendous view, 36,000 foot view on data and how to collect it and so forth. And that is, again, about harmonization. I'm facing this in simple, small data sets where I've tried to actually put a project together by combining two data sets collected in the same institution 3 years apart. And of course, it's hopeless because there's way too many discrepancies. I wondered at that time, is there any machine learning method that can speed up or help us in data harmonization?
The problem is that the meaning of two information collected at two different places, zeros and one, the machine will see the zeros and the ones and will say, hey, it's zeros and ones. Wow, it's perfect. But that doesn't mean it's the same thing. So generally, I prefer, and that's what Masrom is doing. In fact, I'm not doing data management in life, I'm doing harmonization. So we develop since years tools to facilitate that. In fact, the steps are first to decide what you want scientifically across the two studies without too much looking at the different information collected, but scientifically you want to have the diagnosis X or the smoking status or whatever. And then you look at the variable collected, you document if it's possible or not to harmonize, and we are developing our package that hopefully will be ready this summer at the latest to facilitate the data management after that. So not the data management, but the data processing under the same format across the two. But you will always have to sit down and think about the scientific meaning, because just the weight, okay, you can have the weight measured or the weight reported. For your study, perhaps you need the weight measured because you know that the weight reported is biased. Yeah. So you cannot just generate data. It's really dangerous when you harmonize. You need to think about the science that you want to, the papers or the research question that you have. When that is clear, when the variable that you want to generate are clear, then the management with different tools, with Opal that I mentioned, and the R packages and all that, it's not perfect, but you know, the time before we were taking, like the work we were doing in 10 months, 2 years ago, now can be done in 2 with all the tools and the procedures we put in place. It's still 2 months, but it's better than 10.
Any other comments or questions? So Isabel, you know, I hope you, so what we've had to date at our institution has been access to REDCap and some post-hoc help, but it hasn't really been a data capture and management platform. So what this platform is hoping to fill is a gap in really understanding, you know, we may have different questionnaires, we may have our first shot at case report forms, we know what our data sources are, but what this platform can help us to do is to really properly design these tools and think about the pitfalls that could occur. And Isabel and her assistant Rita were very kind to do some pilot work in there before we developed the platform itself. And it is a laborious process, but I think it really enhances the final sort of data collection processes and management processes. But like all things, there are costs involved. So it is like our biostatistical consulting unit, there will be costs. And as this will certainly be up and ready for the fall deadline. For the spring deadline, you may want to think about data management depending on the type of study you're putting forward. And at the risk of getting in trouble with Isabel, if you have some ballpark idea and want to do a quick consult with her about what kinds of resources you should allocate, she may be able to help you. I've been getting myself into trouble by putting her.
Yeah, but I'm not as bad as you.
That's so just bear that in mind, because you know, it's always a bit more costly than we think, but it can save probably a lot of rounds of analyses and a lot of analytic time in the end. So, you know, you'd rather go into that headache free. Any final thoughts or comments from you, Isabel, or from anyone else on the call?
Perhaps just mention, because the questions were related to harmonization. So I didn't talk about Maelstrom tools and resources, but all the tools we are developing are free, open source, and can be used just directly going on the website and be downloadable. Or if you have questions related to harmonization as well, as for the data capture platform, I will be happy to give an. So just contact me.
Perfect. Well, thank you so much. It was fantastic as usual.
Thanks.
Take care. Bye.